For more than 25 years, the Society for Women's Health Research has been widely recognized as the thought leader in promoting research on biological differences that affect the prevention, diagnosis, and treatment of disease. Our organization is dedicated to transforming women's health through science, advocacy, and education. We encourage the appropriate inclusion of women and minorities in medical research and promote the analysis of research data to improve patient care. We live in a time when data initiatives are potentially revolutionizing healthcare delivery. Huge advances are happening in the way data is gathered, and we're collecting more data now than ever before. This data has the potential to change the way we interact with the entire healthcare community. Meet Nadia. She's waiting in the doctor's office. In the past, she would fill out her medical history on paper, but this is no longer the case. Most doctor's offices have made the transition from paper records to the use of electronic medical records. This shift is improving medical documentation, increasing staff efficiency, and enhancing the standard of care. Using Nadia's electronic record and medical history, her doctor explains the impact this information has on her current and future health. Working together, Nadia and her doctor discuss ways that she can actively improve her overall health and reduce the risk of developing the chronic health conditions that run in her family, allowing Nadia to take charge of her health. Nadia's doctor inputs her patient records, medical history, vital records, medication, images gathered from her examination, and other notes taken during her checkup into the electronic medical record. Some of Nadia's information is shared with her insurance company, which monitors claims and cost data on all of their members. Insurers also routinely analyze this data in order to evaluate patient utilization and make coverage decisions. Insurance companies have always had access to patients' medical records, but with the availability and increased use of wearable fitness and tracking technologies, patients like Nadia are generating more data that can be used to paint a better picture of their overall health. While the number of insurance companies using data from health tracking technologies is currently low, this is quickly changing. A 2015 survey found 2/3 of insurers expect data from wearable technologies to be broadly adopted by their industry over the next 2 years. Wearable tech is becoming quite popular and making an impact. A recent study reported that 46% of those surveyed said that keeping track of health data changed their overall approach to maintaining their health or the health of someone for whom they provided care. Data collected and captured in these technologies and tracking devices is valuable for researchers who can analyze the de-identified data and find emerging health trends to see what treatment strategies work in the real world. This data can also be combined with industry-generated data from clinical trials and post-market studies to create a vast repository of healthcare knowledge that can be utilized by numerous stakeholders. Integrating all this data together, a patient's electronic health record, medical history, day-to-day logs from a patient's wearable technology, along with industry and consumer data, can guide treatment decisions using real-world evidence and also identify areas where more research is needed. Making this data accessible to the broader healthcare community can improve health outcomes and individualized treatment for patients. This data has great potential for the future of healthcare and research, but how do we keep the patient at the center of this conversation? In the coming years, doctors and other healthcare providers will be able to streamline Nadia's medical experience by utilizing real-world data to develop a targeted treatment plan based on her individual makeup and family health history. As the scientific and medical communities move toward individualized treatment, much of this data still remains siloed, and many questions remain unanswered about how to best use all the information being generated. To truly transform health, we need to engage and encourage all parts of the research and healthcare communities to work together and integrate this data in a way that protects a patient's privacy, but also helps determine the most optimal treatment decision. SWHR's mission is to transform women's health through science, advocacy, and education. Please join us in our efforts to promote the analysis and use of data specific to sex differences. Together, we can deliver more precise care for women and help to improve quality of care for all patients.